My name is Alan Green. I'm a psychiatrist here at Dartmouth-Hitchcock, and I've been part of Goslar School of Medicine. I've been here for about 15 years. My research involves substance abuse. It's a common problem, nationally, locally, internationally. Almost every family knows someone in their family or a friend who's been affected by substance abuse. It creates disability, creates early death, mortality. My family's been affected by it. My brother-in-law, a brilliant, brilliant guy, at age 44, died of a heroin overdose. He had been involved with substance since he was 17. He was free of it for years. 2 children died. My nephew, 1 year ago, age 21, his entire life in front of him, died of an opioid overdose. What is going on? What's that? Why? That's what I want to know. Why do some people get exposed to these substances and get into trouble with them and others don't? There's obviously some relationship between the amount of substances they take and the vulnerability they might have. My research is interested in this issue of individual vulnerability. Why do some people get into trouble and not others? The way to address this, what we've tried to do, is to look at people who are at high risk for substance abuse. And people who are high risk, in general, have psychiatric problems. So we've looked at people with bipolar illness, people with PTSD, and people with schizophrenia, where the rate of substance abuse is 3 to 5 times the background rate. And what's really strange is that people with schizophrenia, for instance, use substances at this high rate, but it worsens the course of schizophrenia. So why would they do it? What is it about this disorder or other psychiatric disorders that leads to this kind of increased substance use, which worsens the course of their illness? So what we've tried to do is to figure out what is going on in the brain, in the brains of people with, in this case, schizophrenia. So we asked them to come in here, and we put them in the MRI system, in the magnet, study them in magnetic resonance imaging. And what we found is the circuitry in the brain that's involved in reward, in what allows us, you, to experience pleasure, a beautiful day, is blunted in these people. It just isn't working properly. And then, so the reward circuit is blunted, and what we've then had them do is allow them to smoke a marijuana joint, a marijuana cigarette, if they happen to be smokers of marijuana, in the magnet. And what that does is essentially correct, or almost entirely correct, the abnormality. So what seems to happen here is that there's a risk in this circuitry, and the substance, at least to some degree, will correct the circuitry, and yet it makes the disease worse. So we've tried to think about that and try to figure out how that applies to people with substance abuse more broadly, which we think it does. We think that more or less the same thing is going on. It turns out that there's a medication that we've been using and trying that seems to limit substance use to some degree in people with schizophrenia, but has a tremendous number of side effects. It's toxic. So we can't use it very frequently. But we've taken, to try to figure this out, we've taken our research and moved it into an animal model. This is translational research. We put it in an animal model. And the animal model is a model, effectively, of schizophrenia. But what's interesting about, it's a rat. What's interesting about this rat is that the circuitry, when we do an MRI study, it's the same as we see in the patients, exactly the same. And then this animal, this rat, likes to drink alcohol. And most rats don't even touch the stuff. This one does. And this medication, the toxic medication we talked about, limits alcohol drinking in the rat. So there we go. We've got a model that we can probe this model. We have this abnormal circuit. What we're able to do in a rat is we can change the circuit. So we can say, if we change that circuit and make it working normally, will it stop drinking? Or we can take a normal rat and dysregulate its circuit. And what happens to the alcohol drinking, for instance, in that animal. So using these ideas, we can then come up, figure out about this medication. What is it about that medication that seems to work? Can we understand the structure of that medication? Can we come up with one that will change the circuit in the animal, which we think will then lead to something that will limit substance use in people? So just think about this. In the long run, what we're learning about schizophrenia and substance use applies to general substance use, which is very common. And think about what we might be able to do. We might be able to use this to create a drug or a treatment that would really limit substance use in people with schizophrenia, but in anybody. And we also think we can identify the risk profile. So, for instance, someone comes to Dartmouth as a student. If we knew that they had a high risk of getting into trouble with substance use, we'd say, you should avoid it. Be careful of alcohol. Be careful of marijuana. Be careful of cocaine. Just don't do it. It's going to give you trouble. I don't care if someone else, it won't affect someone. It's going to affect you. We might think about it in the future. We might also be able to come up with a situation where we can modify that circuit in people who are at risk. I mean, that's in the future, but just imagine we could then make them effectively resistant to substance use going forward. And of course, this is a way of developing new treatments as well. So that's what we're after. And I want to get to the point where my family, your family doesn't go through what we have already gone through. Where my brother-in-law wouldn't have died, where my nephew wouldn't have died. This is a waste. It's just a waste. That's what I'm trying to do.
Dr. Green, I'm deeply sorry to hear about your brother-in-law. I've heard you tell the story of your nephew. I didn't realize you've been stricken by this twice, and so I'm really sorry. But it shows that so many of us, all of us, are stricken by this substance abuse plague that we're in. You receive a lot of funding through Synergy and through your work at Geisel to do some research. What would additional funding through the Innovation Project allow you to do that you're already not on the trail of?
That's a great question. We, as you point out, we get almost all the funding for this research comes from NIH, National Institutes of Health. And I'm very grateful for the research funding that we get. But as anyone who's an investigator knows, NIH funding is relatively limited. It doesn't provide a lot of what you need. It doesn't support the research infrastructure that you need, the equipment that you need, the imaging equipment. It doesn't support a lot of the work with some of the animal models. And it doesn't support some of the staff that we have. So if we had more funding, we'd be able to move this just more quickly. To me, that's the most important thing. I would like to get to rather than have this happen in 10 years, have it happen in a year, or 2 years, or 5 years. That's what I'm trying to do. I mean, this is a rush. We have this situation in front of us. I mean, it's not new. The opioid problem is new. This is something that's been going on for a long time. My career has been dedicated to substance abuse long before, unfortunately, my relatives died. It's sort of a strange situation. But I'm determined to do something about this. And the people working with me are on the team together.
Well, thank you, Dr. Green, and thank you for sharing your personal story. I also am sorry for your loss. So you talked a little bit about what you're looking for the future. Have you considered how you could replicate your work so that it can be spread across the country? Because as you said, this is an international problem, it's a national problem. What do you see for that?
Well, in terms of being spread across the country, anyone who does research like this, we're part of an international community. You know, I'm on email and texting and with people internationally all the time. So it's a rocket that's going up, and we're part of it. What we're trying to do is to figure out how we can maneuver that rocket. And the rocket is research, in this case in substance abuse. I think there's a lot that's changing. 20 years ago, if I were speaking to you, someone might have said, or others might have said, it's willful misconduct. The reason that people get involved in substance abuse is because they just don't know better, or they're just weak people, or God knows what. That's not the case. I mean, yes, people should avoid it to some degree, but on the other hand, I am convinced that this is an issue of risk. It's an issue of vulnerability. And I'm trying to get at precision medicine. I'm trying to figure out who do I treat in this way? Who do I treat in that way? How could I prevent it? How can I essentially make someone almost like Teflon so they don't get affected? I mean, that's what I'm trying to do. And there is an international research community doing this, and we're part of it. I think we're an important part, but we're part of an international community of research.
Well, thank you so much for being here with us today. Your work is so important, especially at this time in our society.
Well,
so
thank
we
you,
really
both
appreciate
of you.
it.
Thank you for the opportunity to share this with you. I think you can tell it's important to me, and I think it's important to Dartmouth-Hitchcock. I think it's important to our country, and I'd like to do the best I can. Thank you very much.
Right. Thank you.